Hello, everybody. Welcome. Can you guys hear me? We're live streaming. Hoping everybody can see me okay. Excellent. So, where is everyone joining us from? I'd love to hear. So, we got some Calgary, California. Awesome. New York City, Indiana. I hear New York City's getting some slams with some snow. Washington. United Kingdom, Florida, Georgia, Philippines. Love it. Thanks, guys, for joining. So excited that you guys are joining me today. Hope everybody can see me okay. Got some Canada. Excellent. Lovely. I love it. All right. So the people in live stream, can you see everything okay? Can see my screen? PA? That's where I'm from. Loud and clear. Love it. Okay. Well, thank you guys for joining me today. I'm so excited for you guys to be here. I'm so excited to see a bunch of some people from all over the place joining us. Excellent. All right. So we are dissecting and talking about case studies today. So, how do people feel about case studies? Do we like them? Do we hate them? I know they can be a little crazy, right? So that's what we're going to talk about today. So we're going to talk about case studies. We're going to do two case study samples today, okay? So case study number one, let's meet our client, right? So we have a 65-year-old male um, client who was admitted to the emergency department with a high-grade fever, altered mental status, blood pressure of 80 over 40. His initial labs showed an elevated white blood cell count and lactic acidosis. What are your initial assessment findings and nursing intervention? So, what are the first things that we are thinking of that could be going on with this patient with an elevated white blood cell count, fever, low blood pressure, and lactic acidosis? What are we thinking? Infection, right? I'll take infection. Absolutely infection, sepsis. Yeah, I'm going more towards septic shock. Excellent because of that low blood pressure. I have lactic acidosis. I have an increased white count. Absolutely. Absolutely. Okay, so we're all kind of on the same page. Excellent. Yes. Yes. Good. Okay. So, based off of our patient's presentation, it seems that he may be in septic shock. So what's going on? What's kind of alarming us on that one is going to be that fever, altered mental status, that blood pressure, and that lactic acidosis, right? So we really need to be making sure that. So what else do you think we need to be assessing for that? So you guys, we're thinking infection. So what are some interventions we might need to be thinking of? Fluids, absolutely, we need to start them on those fluids, right? And if it's sepsis and septic shock, what do I need to start them on early on? Antibiotics, those broad spectrum antibiotics, NIV fluids, excellent. What other assessment findings would we see with septic shock? What are we thinking? We definitely need blood cultures. I saw that one. Excellent. What other assessment findings are we going to see? Tachycardia, epinephrine, or fever, right? We saw the fever. So now we're to think about tachycardia. What else? Hypotension, which we have. Excellent. Tachypnea, yeah. What about my urine output? Do you think it's going to be increased or decreased? Decreased. Low, right? It's going to be low. Excellent. Good. Yeah. So, reminder. So, let's think. That's a good start, right? Let's talk about that. Remember, early recognition and prompt interventions is crucial in septic shock, right? So, we talked about other assessments and interventions we would prioritize. We talked about that. We probably need to start them maybe on some oxygen, right? We want to make sure what our oxygen level is. Initiate those IV fluid resuscitation with their crystalloids or colloids to restore that blood pressure. And remember, those crystalloids are going to be my normal saline, my lactated ringers, and my D5 W. So that's going to be my isotonic solutions, right? My colloids are going to be my albumin, packed red blood cells, or FFP. Because I really need to do that adequate fluid resuscitation. Okay, so we talked about, you guys told me about that decreased urine output, but how much urine output per hour tells us that there's good hydration and good status, kidney status? Who can remember? 30 milliliters an hour, okay. Yep, 30 milliliters an hour, good. I'll take that one. And it should be 0.5 milliliters per kilogram, right? That's our most adequate one. 0.5 milliliters per kilogram, or at least 30 milliliters an hour. Excellent. So let's discuss the next gen exam, right? So it is a comprehensive assessment that evaluates your nursing knowledge, your clinical reasoning skills, and it covers a wide range of topics, including septic shock, right? The exam is going to consist of multiple choice questions to make sure you assess the ability to apply your knowledge that you learn in theory to practical scenarios, right? So let's think about that, emphasizing that critical thinking, clinical judgment, and decision making skills. To prepare, you really should review your textbooks, practice sample questions, right, and case studies, and participate in simulations, right? It's going to be really crucial for that. It's also important to stay up to date with evidence-based practices and guidelines. In addition, we want to have some individual study, maybe forming some study groups may be beneficial. Um, Collaborating with your peers to kind of bounce ideas off of each other is a fantastic way to strengthen your understanding and retention of those critical thinking attitudes. And it's also a huge opportunity to practice communication and teamwork skills in the nursing profession, right? So we can offer you guys some small groups. We have small group settings that can facilitate that, right? All right, so let's go back to our interventions, right? So thanks. I'm glad that we got some guidance on our NGN exam. So let's go back to that septic shock case study. So we talked about other interventions, right? So it's really important to closely monitor the patient's response to the interventions and reassess their condition frequently. We need to continue to administer those broad spectrum antibiotics, adjust that fluid resuscitation based on the patient's response. And what's the best way to um assess that information, the patient's response? What am I going to be um reassessing constantly? What do we think? Our heart rate, excellent. Heart rate, blood pressure, our vital signs, right? That urine output, right? And if my patient has to be on those vasopressors because of that blood pressure, I really need to maintain that I'm maintaining that adequate mean arterial pressure. Who remembers what that adequate mean arterial pressure that's going to indicate that I'm perfusing my vital organs appropriately? Can anybody tell me? Above 65. Excellent. Mean arterial pressure greater than 65 is going to say that my vital organs are being perfused. Excellent. So we also want to make sure that we are monitoring our mental status, right? I want to get some labs, lactic acid, BUN, creatinine, monitoring that metabolic acidosis, right? Remember, NGN questions will give you normal labs, the normal lab values ranges, but it's your important time to interpret it. All right, so what interventions are going to be our priority? What are our priority interventions for septic shock? What are we thinking? IV fluids, that fluid resuscitation. And then I need to get those cultures and started those broad spectrum antibiotics. Excellent job. Excellent. So it's really important for me to, once I start recognizing and assuming and even predicting that sepsis might be an issue, I need to draw my two blood sets cultures. Someone had said earlier those are two large bore IVs, right? Get my lactic acid. Within 60 minutes of recognizing the sepsis, we need to start broad spectrum IV antibiotics, usually vancomycin, right? And then immediately upon that blood pressure lowering, I need to start giving those fluid resuscitation, right? Isotonic fluids, those boluses, and repeat them based off of my patient's presentation. Because I want to prevent them to going into shock. I don't want them to progress from that compensatory stage, right? After the patient may be unresponsive to IV fluids, or if I start having fluid overload with them, I may actually have to start them on those vasopressors, epinephrine, norepinephrine, dopamine, one of those. Okay? All right. Now, some generalized nursing care. So, how does all this fit into that generalized nursing care? And we have to think about that. That falls into a different area of that NCLEX test plan, right? So, we need to provide adequate nutrition. It's crucial for our patients with septic shock. But in the early stages of septic shock, the patients are going to be hemodynamically unstable. So that takes priority of making them hemodynamically stable over our nutrition, either enteral or parenteral nutrition, right? Once that patient stabilizes, we can start initiating some enteral feedings to prevent complications with the prolonged fasting. So, how do we get our patient ready for discharge? How do we think of that? Motility. Motility is big on that one. Remember, septic shock is just one of the many topics that you will encounter on your journey to become a nurse. The NGN exam will test your ability to apply that knowledge. That's the big thing. Apply that knowledge, make sound clinical judgments, and provide safe, effective care to our patients. So keep studying, practice, and never stop learning, because continuous learning is the key to success in nursing. Okay? All right. So, if you need further help with this or question, do not hesitate to reach out to us, guys, because we offer that small group tutoring and our private tutoring. So, before we move on to our second example, I'm going to leave it open to you guys. Do you guys have any questions on anything that we just covered real quick on septic shock? You guys know priority, fluid resuscitation, starting those broad spectrum antibiotics, cultures before the antibiotics. That's the big one, right? We have to can't forget that. Feel okay with that? All right, excellent. Okay, so let's go on to our case study number 2. Um, I had a student ask me if we could provide more examples, so let's talk about it, right? Let's talk about some more examples. So let's consider another hypothetical case. We have an 85-year-old female admitted to the emergency department. She's febrile, appears confused. She has a history of GERD, macular degeneration, and urinary incontinence. Her initial lab results show leukocytosis and elevated lactate levels. What should our initial nursing interventions and assessment be? What are we thinking? Yes, someone asked a very good question. Do we give that we start the broad spectrum antibiotics while we're waiting for those cultures to come back? And then we can change those antibiotics, well, physicians will change those antibiotics depending on that culture. All right, I'll take your analysis and culture. Of course, Angela. Assess my skin, right? Delirium. Okay. So what conditions are you concerned with? UTI. I would definitely be concerned with the UTI, right? Confusion, elderly patient, right? That always goes into play with that. Confusion. Good. So we were talking about, so what are our initial assessments? You guys kind of nailed some of them already. Vital signs. Someone said vital signs. Assessments, interventions, maybe some uh, antibiotics, cultures, urine culture for this time. UA, specific gravity, fluids, yep. Oh, someone made a good point. What is their baseline neurological status? Excellent. What is that baseline? Oh, blood sugars. Blood sugars are always important. Level of consciousness. Good. So what other signs and symptoms might we see based on the client's age in presenting symptoms? What are we thinking? Protein, good. Confusion, excellent. Positive for protein in my urine. Delirium, Dehydration. Why is that a key thing there? Respiratory status, excellent. Dementia, Good. So having that loss of appetite, excellent. Yes, perfect. So sepsis, right? So sepsis is when someone has an infection somewhere in their body, right? Could be anywhere, but their body just can't tolerate it. They cannot fight that infection. So that leads to a widespread inflammation over all over the body, right? Is sepsis contagious? Can you spread sepsis to somebody else? No, you can't spread sepsis to the other people, but you can spread the initial infection that led to the sepsis to other infections. Absolutely. So what causes sepsis? Right? Any infection, any inflammatory process that can go into the body can cause and lead to sepsis. Um, Germs that get into our body through anything, through little cuts, by not washing our hands, by holding our urine, those kinds of things. But bacteria or sepsis doesn't always have to be bacterial. It can lead from viral infections such as COVID-19, influenza, or fungal infections. So, let's do a critical thinking pause here, right, guys? So let's think about how these different situations that lead to sepsis, pneumonia, right? Pneumonia, our UTIs, especially if we have those our catheters, our CAUTIs, right? Our catheter associated urinary tract infections, wounds, burns, because I'm taking away that layer of protection. Remember, NCLEX tip, any infection can lead to sepsis. Bacterial infections are most common, and the elderly are at highest risk. Why are the elderly more susceptible to sepsis than, say, a early 20s-year-old? What do you think? Why are they more susceptible? Their immune system, they have a weakened immune system. They're more vulnerable, right? Plus, sometimes their nutrition may not be the best, right? They might not be drinking as much. They might be not getting adequate nutrition that they need. But that immune system and our comorbidities, excellent. Our comorbidities help with that too. Excellent job. So thinking back on our patient, what caused our patient's sepsis? What do you think caused our patient's sepsis? And UTI, right? Our UTI, absolutely. That urinary incontinence leading to the UTI. Excellent. So let's think. So we have that trigger, right? The bacteria is getting into the bloodstream and causing an immune response. That's going to lead to a severe vasodilation that's causing those blood vessels to just vasodilate. Then because of that vasodilation, that is going to lead to severe hypotension because those big blood vessels can't hold much pressure due to that vasodilation. So that is going to cause a decrease in my perfusion, right? So that decrease in that perfusion is going to then decrease my blood pressure. And it's going to decrease the blood flow to those vital organs, my tissues. And that's going to lead to shock because remember, when that lactic acid is produced, that is telling me that my body is going, my cells are going to an anaerobic metabolism, meaning they're not using as much oxygen because they're not getting that oxygen because of the perfusion. So remember, we talked about what are important interventions do we need to do now? So our patient has a UTI. Fluids, excellent. Start those fluids. Antibiotics, urine and blood cultures. It is important to do both of them because I want to see if it's in my bloodstream. Yes. Excellent job, guys. Get an IV, right? Do that fluid resuscitation, right? So, based on our presentation for our patient, I'm going to assess my patient's vital signs, including my blood pressure, heart rate, and oxygen saturations. I'm going to obtain both blood and urine cultures, start those blood spectrum antibiotics, and start doing that fluid resuscitation to restore her blood pressure and improve her perfusion. In addition to those, it is really, really crucial to closely monitor my patient's mental status, urine output, and my central venous pressure, because that's going to tell me my hydration status, right? You would also need to initiate a sepsis bundle protocol, which varies from different hospital to hospital, but we always have a sepsis bundle protocol, which involves obtaining, you guys nailed it in the chat, my lactic acids, my lactate levels, repeating those cultures if necessary, and considering sources of control of measures, like maybe if they have that urinary catheter, removing that catheter, or draining an abscess, or something of that kind of nature, right? So, how would you describe a broad spectrum antibiotic? How would you describe that? A lactate level greater than 4 is considered septic. Excellent. It can kill most bacteria. It covers all bacteria. It is a stronger one. Yes, I'll take that. It is stronger. It is not very specific to any type of bacterial infection. It's more general. Good. Excellent. I'll take it. Perfect, guys. So let's do a vitals check, right? Let's do this. So let's think. A blood pressure of 90 over 54 with a MAP of 68. Is that concerning or not concerning? That is actually not concerning. Why is that not concerning, guys? Because of that map. That map is greater than 65. Excellent. So that's telling me that my vital organs are still being perfused. Good. Heart rate of 123. Concerning or not concerning? I'd say that's concerning. Respiratory rate 28. I'd say that's concerning. Oxygen saturation's 95%. Nope, that's greater than 90. That's good. I'll take that. Temperature of 101.6. That's concerning. That's telling me that they have some sort of infection, right? A pain scale 4 out of 10. Clients reports not feeling right. That is concerning. That is concerning. Why is that concerning? That impending doom feeling. Excellent. Because of that impending doom. That client says they are not feeling right. That impending doom. Good. Yeah, the pain, remember, we think pain doesn't kill anybody, right? But so that having that they don't feel right, that impending doom. That temperature of 101.6, that's elevated, that's telling me that they are febrile, that they have that infection going on. Those oxygen saturations are good, and my heart rate and respiratory rate are abnormal. We need to be talking about that. Okay, so what type of shock do you think our client is experiencing? Septic shock, but what type is that? Remember, we have three main types. We do a septic, not neurogenic. Distributive. Excellent. So distributive. So distributive shock is going to be caused by neurogenic, septic, or anaphylactic, right? That's going to be our distributive shocks. So recognizing our cues, what are our assessment findings, right? Decreased oxygen, hypotension, tachycardia, tachypnic, warm, flushed skin. Guys, with septic shock, that's the only time that we are going to have warm, flushed skin, and that's because they're febrile. And decreased level of consciousness. So for septic shock, I'm going to do those IV antibiotics and IV fluids. That is my main treatment. Anaphylactic, I need to give my epinephrine, corticosteroids, and bronchodilators. And then neurogenic, which is going to be my spinal cord injury, I'm going to do my cooling and supportive care. All right. So guys, if you are struggling with this mass amount of material, go back, take your time, review your notes. Sit there and review things, try to list and go through different materials and go from there. Okay? All right. All right, guys. Well, I have a couple questions. I'm gonna go back to these vital signs real quick. So the reason why that blood pressure was not concerning was because the my mean arterial pressure was greater than 65, so that's why that my blood pressure was not concerning. All right, guys, I thank you so much for joining me. Remember, Archer Review can help you across the nursing life scan from nursing, pre-nursing to nursing school, all the way up to our advanced practitioners. If it didn't show the map, then it would be concerning, but we have that value of that map. Yep, absolutely. Okay, remember albumin is listed as that colloid. So let me go back to that real quick. So that is a colloid there. Albumin is my colloid. Live free webinars are not saved anywhere. I apologize. I would not. There is no tall tale sign of septic shock. I would not say that. Someone asked if there is a tall tale sign for septic shock. Um, being a fever and level of consciousness, no. So the blood pressure is low, but remember the map is the biggest thing, is that that mean arterial pressure being maintained of our greater than 65. 65 or greater is telling me that organs um my organs are being perfused adequately, right? My essential and important organs. Range of map is greater than 65. 60 would be too low. If it was 60, it'd be too low. All right, guys, I thank you for joining me today. Um, thank you very much, guys. I hope you have a fantastic rest of your day. If you guys need some more help, go back to Archer, look at our small groups, individual private sessions. Distributive shock is the main shock. Septic shock falls under distributive shock. All right. Thank you guys. Have a wonderful day. And I hope to see you at other future Archer Review materials.